Type 2 respiratory failure. In type 2 respiratory failure, which is a ventilation defect, the amount of oxygen reaching the alveoli is decreased. As the amount of oxygen reaching the alveoli is decreased, partial pressure of alveolar O2 is decreased. So, the amount of oxygen reaching the blood vessel is also decreased. So, partial pressure of arterial O2 is decreased. So, what about carbon dioxide now? Now, in order to study about carbon dioxide, we have to think about two things. One is gradient and another is interstitium. What about the gradient? Whenever the carbon dioxide is moving from the blood to the alveoli, as there is a ventilation defect, the amount of carbon dioxide in the alveoli keeps on increasing because the alveoli can't remove the carbon dioxide. So the amount of carbon dioxide in the alveoli concentration is more in alveoli than the blood vessel. So the gradient has been damaged now. So the carbon dioxide doesn't move from blood into alveoli and the carbon dioxide concentration in the blood increases. Similarly, in some cases where there is interstitial damage, the transport itself is not happening, so the amount of carbon dioxide in the blood is increased. So partial pressure of alveolar O2 is decreased, partial pressure of arterial O2 is decreased, but partial pressure of arterial CO2 is increased. Now, what about partial pressure of alveolar minus arterial O2? As alveolar and arterial O2 both are decreased, so the partial pressure of A minus AO2 is normal. Now, what are the examples for type 2 respiratory failure? We will remember it as three headings. One is generator, one is pump, and effector. Generator is what makes the signals. Then pump is what causes the contraction. And third effector is our lung. First, generator. Generator is our brain. Whatever the defect happens to our brain, for example, it may be accident or it may be some drug related, anything which causes the brain to not function. In that situation, the respiration also won't happen, the ventilation won't happen, and it causes the type 2 respiratory failure. Now the pump. Any disease causing damage to bones and muscles, that is the chest wall. If anything causes damage to the chest wall, it constitutes the type 2 respiratory failure. For example, it may be kyphoscoliosis or myasthenia gravis of the muscles, etc. Now the effector organ. In the effector organ, we will remember it by SIC, that is our lung. S stands for severe ARDS, that is severe non-cardiogenic pulmonary edema. In mild to moderate cases, there is only inflammation, but in severe cases, there is damage of the interstitium. I stands for interstitial lung disease, and C stands for chronic bronchitis. Now let's